Good evening, everyone. Today I am here on the place of my colleague Dr.Muskbar. She couldn't be here for some reason, so I am presenting this on her behalf. Which is a sputum positive is around 2% to 28%, which depends upon the study population, definition used, and the treatment regime. The prime cause of the drug-induced liver injury among the first-line drugs is the paracetamide, isoniazid, and the rifampicin. The most primary reason for the hepatotoxicity is the paracetamide, and followed by isoniazid and the rifampicin. So the drug-induced liver injury can be classified on the basis of pattern of liver injury into the hepatocellular, cholestatic, and the mixed one. Early diagnosis of ATT induced liver injury and the pattern is very important for the appropriate selection of drugs in management of ATT induced liver injury. According to American Thoracic Society and the International Delhi Expert Working Group, the ATT induced liver injury was defined on the existence of any of the following criteria. The first one is the rise in the alanine aminotransferases more than or equal to the 5-fold increase from the upper limit normal in the asymptomatic patient. The 2-fold or the more than 2-fold rise in alkaline phosphatase along associated more than or equal to 2-fold elevation in the concentration of GGT above the upper limit normal without any bone pathology. Or the third criteria is the more than or equal to 3-fold rise in ALT concentration and concurrent elevation of bilirubin concentration surpassing 2 times of upper limit normal. So how we identify this pattern of drug-induced liver injuries depend upon a value which is known as R value. What is R value? R value is simply a ALT activity divided by ALP activity. So the ALT activity is patient ALT upon the upper limit normal, and the ALP activity is patient ALP upon the upper limit normal. So we draw a conclusion on this division criteria. So later on we will know how we mark the boundaries for these things. So the classification of pattern of liver injury will be classified into hepatocellular pattern. If the drug-induced liver injury shows R pattern more than 5, it means the ALP levels are very low and the ALT levels are very high. So it leads to more than 5, more than value of 5, known as hepatocellular pattern. In the mixed pattern, the R value is between 2 to 5, and in the cholestatic pattern, the daily R value is less than 2, in which the ALP is very high rather than the ALT. So the objective of this study to determine the pattern of ATT induced liver injury in patients with drug-sensitive thoracic tuberculosis. The main outcome measures and study design. The main outcome measures pattern of ATT induced liver injury study design for cross-sectional study. It was done in OECD, and the subjects were 120 patients selected by non-probability consecutive sampling technique. All patients diagnosed with liver injury taking ATT who fulfilled the inclusion criteria were included in the study, and detailed demographic and medical history was taken. Each patient was evaluated for symptoms of ATT-induced liver injury followed by blood sample collection to show LFT's dearrangement. R value was calculated from the confirmation of pattern for liver injury. The outcome of 120 patients, among them 70 were male, shows that 58.3% were male and the female were 41.7%. The most of the patients were treated with ATT for pulmonary tuberculosis was 62%, and followed by the extrapulmonary with the 37.5%. And the most common clinically presentation complaint was nausea, followed by jaundice and vomiting, and then anorexia, dizziness, and abdominal pain. The pattern of drug-induced liver injury was hepatocellular in 28 patients, which shows the 23.3% of patients, mixed pattern in 19.2%, and the cholestatic pattern in the 57.5% patients. It concluded from the study that the cholestatic pattern of DILI was the most common reported in patients treated with ATT for drug-sensitive thoracic tuberculosis, followed by hepatocellular and the mixed pattern of DILI. Thank you.
Teacher is Dr. Naresh Dev, and he will talk on pulmonary aspergillosis.